As we celebrate 75 years of the NHS, as well as reflecting on past achievements, we want to look ahead and showcase how we're continuing to transform through innovation. Our breast unit was one of the first in the UK to use the Magtotal approach to improve the surgical process for treating some breast cancers.
This is an example of using dual technology. So we use a magnetic sea to localise the breast cancer, and we use an injection of supraparamagnetic iron oxide in order to localise the lymph glands. And we use both of those during breast surgery so that we can find what we're looking for to enable patients to have their adequate surgery.
We've introduced robotic assisted surgery to perform urology and upper gastrointestinal surgery, improving outcomes and shortening recovery times for patients.
So this is the Da Vinci Xi, which is a surgical robot. This is called the patient cart. So this is the actual instrument which operates on the patient. This is the console, the surgeon's console, and this is where the surgeon who operates sits, which controls the instrument that is operating on the patient. So the views are better, the stability is better. And then finally, because of that, the fine control is better. Fine dissection, lower volume of blood loss, significantly less pain and quicker recovery.
We opened our new Wadstone Wing this spring. The building houses our maternity, antenatal and gynecology outpatient services and incorporates a state-of-the-art facility for children's emergency care.
This new facility has just been amazing, both for the teams that work within it across the whole of the hospital, but also the children and families that are using this facility. It is state-of-the-art, it is light, bright. It's been designed based on feedback from parents and children and young people of all ages. We've now got designated resource beds from the information boards that have been built around not just parents and carers, but children. So children can look at the board and navigate their way around, from the interactive whiteboard, from the quiet room, which we use as for any child that's got any form of neurodiversity that can't cope with the sensory overload that an ED department is. This whole building, from its from the equipment that's in it, from the way it's been designed, has just made a huge difference. The staff, it boosts morale. Working in this environment it's uplifting. So we've always given the best possible care to the children and young people and their families that have used our service, and now we're providing in the best state-of-the-art facilities.
We've implemented innovative programs to help patients return home safely or avoid a hospital admission completely.
With our hospital at home service, it offers a unique and exciting opportunity for patients to receive hospital standard care in their own homes. Here at Buckinghamshire, we're ambitious. We're aiming to have over 200 beds by April 2024.
We first heard about the virtual ward at home at the end of last year when David had an exacerbation, so he can do his readings twice a day and then submit them. And we know that they are looked at, because any of the readings are slightly different to the previous. There is a phone call from the nurse within an hour, isn't there, just to check everything is all right. It's an excellent system, it really is.
We're addressing health inequalities by working with our partners and the voluntary sector to take our services to the heart of local communities.
We've been working on Health on the High Street as a concept over the last year. It provides an opportunity to provide health care and voluntary services right in the heart of our local community. Aylesbury has higher levels of inequality and lower life expectancy than the rest of Buckinghamshire and the UK. It ranks amongst the 30% most disadvantaged in England. That's why we've chosen Unit 33 in Friar Square Shopping Centre to be our first Health on the High Street pilot site. Health on the High Street provides the opportunity to provide services such as diagnostics, prevention, older people's, maternity, children's and family services right in the middle of the town centre, making it easily accessible and responsive to local events. So we'll be here soon in Unit 33 in Friar Square Shopping Centre.
Although we're always transforming and innovating, the one thing that remains a constant is our people's commitment to delivering outstanding care and our commitment to being a great place to work.
Happy 75th birthday NHS!
Happy 75th birthday NHS!
Woo! Happy 75 years NHS. Very proud to be a nurse here at Buckinghamshire Healthcare NHS Trust.
Happy birthday NHS, 75 today.
Happy birthday to the NHS for 75 years.
I'm really enjoying working here, and it's very rewarding of what I do, and I work for the pain team, and yeah, it's my pleasure to be working for NHS.
Happy 75th birthday NHS. Great place to work, great people to work with.
It's a very happy atmosphere and we all work together as a team.
So, happy birthday to the NHS, 75 years old. I've only been in it for 37 years, but it's been a great 37 years.
Happy birthday NHS!
Thank you to all our colleagues, partners, volunteers and everyone in our local community for your continued support over the last 12 months.